Hi, I'm Dr. Ken Graham. Welcome to the office. And congratulations on making a really good choice. We're here to help you. We've been doing it for 25 years. We've helped thousands of people regain their health. And now it's your turn.
You are the only doctor, honest to God, you are the only doctor who's ever gotten my back and neck adjusted where I have absolutely no pain. And this time, coming back to see you, I've traveled 3,000 miles just to have you adjust my neck and my back, and I feel wonderful. Thank you, Dr. Ken.
My name is David, and when I arrived in Dr. Ken's office, I had a severe pain on the left side of my neck. That had been going on and off for almost 9 months. It is basically gone now since he's been treating me.
Hi, I came to see Dr. Graham. I have long-term sciatic issues and neck issues. Kira has had some ADD, other issues with school. Since seeing Dr. Graham, she has turned around, her attention has gone, her attention span's increased. Kelsey's neck doesn't hurt at all anymore, and we're seeing great improvements with both of them.
So when we're asking ourselves, what does this body need to be healthy? You know, the obvious comes up. Good food, good water, exercise, rest, a great attitude, lots of love and appreciation in our lives. We need air to breathe because good fresh air helps purify our bodies and gives us energy. But the most important thing that we can have in our body is life force. It's innate intelligence. Because if you don't have the life force, like for instance if we had a corpse lying on the ground, I could give them all the best food, all the greatest water, all the great appreciation and exercise, but wouldn't do it a bit of good. So the most important thing is innate intelligence expressing freely through your body. And the organ that does this, or the system that does this, is the nervous system. Without the brain, the spinal cords, and 100,000 miles of nerves that go through your body, you wouldn't be able to carry on life, you wouldn't be able to adapt to life, you wouldn't be able to communicate with yourself. So as a chiropractor, the most important thing I can do is make sure there's no interference to that nervous system.
Hi, y'all. When I came in here, I was twisted. I had a question mark in my spine, and man, was I hurting. My muscles in my back were killing me. I hurt like I never hurt before. A few sessions with the big guy here, and he got me straightened out. I feel great. I'm down the road in the pink.
I came in with a lot of pain and I feel much better. I can get in and out of the car again. It's a miracle.
One of the things that's happened in our lives is our food has become genetically modified. We've gotten things changed where people don't really eat healthy food anymore. And they come in with all these digestive problems, they come in not feeling well, and sometimes the spine, we get it lined up, but they need some nutritional support to hold the adjustments and also to make themselves feel better. Whenever we start with nutrition, the first thing we need to fix is digestion. Are you making enough hydrochloric acid? Are you making enough enzymes? Or do you have enough enzymes in your body to break your food down? Is your gallbladder free and clear so that you can digest fats? Those are the place we start. After we fix the digestion, the next most important thing, and it runs rampant in this society, is sugar control. More people have sugar control problems. If you're getting sleepy after meals, if you don't have the energy you want, you feel fuzzy, cloudy thinking, sometimes that can be because of an upper cervical adjustment. Sometimes it can be because your sugar is off. And we need to fix that for you.
Hi, my name is Paula, and I want to tell you about Dr. Ken helping me with my digestive problems that I suffered with for about 3 years. My symptoms included pain, nausea. I was unable to function with my normal life. I wasn't able to keep food down. I wasn't able to eat, and I was miserable.
And how long did it take after we got you on the right supplements?
It was almost automatic.
Instantaneous?
Instantaneous, and along with changing my diet to include more raw food, I was able to kind of turn my body around and be happy and pain-free.
Great, thank you.
Thank you, Dr. Ken.
Okay.
Taking your supplements, Cataplex B, Cataplex G, Zypan, Multizyme, and the fish oil, my nail is no longer cracked.
Hi. When I was choosing to become a doctor, I chose to be a chiropractor for a couple of reasons. One, I have a firm belief in the body's innate intelligence that knows how to heal and how to fix and how to correct things. If we help and aid that intelligence, if we free any interference to that intelligence from expressing itself, the body's going to be healthier no matter what. You have a lot of choices in your health care. I personally would rather not take the drugs or do the surgeries unless they're absolutely necessary, because every single one of them has a side effect. So if I can help you shift your life in such a way that your body heals itself, I think that's the greatest wisdom and the greatest gift I can do for you.
Before Dr. Ken, I had headaches, I couldn't sleep right, I grinded my teeth really bad. Everything just was not good. Now after it's been a year and a half, 2 years, I feel good, I have energy, my back doesn't hurt all the time. I can work very well because I work with ideal poker, so repetitive motion is really hard on your back and your arms and your hands. It's made all that much better. And yeah, without Dr. Ken, I would be a hurting woman. Thank you so much.
Hi, my name is Dale, and I've been a patient here for a little over a week. When I came in a week ago, I was walking with a cane from a very severe accident that I had been in. And I had been walking with assistance, either a wheelchair or a walker or a cane, for 7 months. And after just 2 treatments, I walked out of here without a cane. And a week later, I'm cane-free for life. So it was very exciting. And I feel different as well as walking independently. So I'm just so grateful for Dr. Ken.
The important system in your body, as I said before, is the nervous system. The nervous system is what controls everything in our body. It's what tells the body how to do what it needs to do at the right time, in the right place, with the right coordination. The nervous system is so important that in an embryo, when our bodies are being built, the first recognizable system is the primitive street, the brain and the spinal cord, being built. And then the next thing that shows its importance is it's the only system that's completely encased in bone. Our skull encases our brain. Our spine encases our spinal cord. And out of that comes the nerves. So the brain, or the part of the body that's most important in the nervous system, is this part. And this part of the head is right there. And that's where your spinal cord goes through. And if that gets misaligned or for any reason deranged, we get pressure on the spinal cord, and that can affect any part of our body, from our digestive system, our big toe, to our kidneys, to our lungs. So one of the key areas is this area up here. So we want to make sure that that's free and clear, able to move properly, and that there's no interference to the nervous system at that point. This is called your occiput, that's called your atlas, and that's called your axis. And that's where your head does most of its turning.
Hi, I'm Frances Brown. I'm a therapist, so seeing Dr. Ken was a unique opportunity to take what I thought I knew about what was in my head and apply it to what was happening to my body. I came in with some really uncomfortable shoulder, neck, and back pain, and thanks to his help and a lot of talking help as well, I'm a lot better. I'm walking better. My posture has improved 100%. I do Pilates work and a number of other exercises. So whenever I get a little twinge of anything, I'm in the front door to see Dr. Ken. And thank you for that, Dr. Ken.
Hi, I'm Marilyn, and I had a problem with sciatica. Went to my doctor, who sent me the physical therapist, who sent me to the surgeon, and nothing helped. I wound up coming to Dr. Graham, and let me tell you, there is no place else. There is nobody else. I am cured from my sciatica. I come in now and then for an adjustment. Always happy. I hope he does the same for you. I hope you come in as often as possible. Thank you.
It's Kat, and I'm a patient of Dr. Ken's. And I want you to know that I've done chiropractic for a long time, and it took me years to find someone who's as good as Dr. Ken. The first time I came in, I was in serious distress, and he just took care of it right away. Within a week and a half, I was totally stable. More than that, he cares about me as a person, and on a regular period when I come, he makes sure that I have exactly what I need nutritionally, emotionally, and other things. And in the time that I've been working with him, I've improved tremendously.
So in terms of chiropractic, what we would expect is if you're having trouble with your feet, your knees, your lower legs, sciatica, things like that, we would expect to find a problem in this area of your spine. If you're having trouble in your mid-back, the pain between your shoulder blades, those sort of things, we would expect challenges in this area of your spine. If you're having problems in your wrist, your thumb, your shoulders, we would expect challenges in this area of your spine. And if you're having trouble with headaches, vision problems, we would expect problems in this upper area of your spine. Now, don't forget, every single nerve comes down through here. So sometimes low back pain and leg pain can be affected by this upper one. The other thing you also want to recall is that the body does whatever it can to bring the eyes level. So if your back is out like this, you don't walk around like that, you start to do this. So sometimes the problem can be down here, but you start hurting up here. Okay? The other thing we want to look at is the organ system. Every single organ in your body has connections to the spine. Down here in the lower intestines and female and male problems with these organs, we would expect to find challenges in this area of the spine. For the small intestine, the adrenals, the pancreas, sugar control, liver, we would expect to have challenges in this area of the spine. The stomach, kind of your mid-back, that's right below your shoulder blades. For the lungs and the heart, this area of the spine, which is your upper back. Then we also get all of your glands, all of the glands to your neck, your throat, your eyes. They come off these cranial nerves. So these upper cervicals can really affect the cranial nerves also. So everything can be affected by the nervous system from somewhere. Just this area of the spine tends to do schematically down the body. That's what we're looking for when we check your spine. Those are what we would expect to find as far as symptoms being caused by subluxations. Oh, so whenever you come in, one of the things we're going to be looking at, one of the ways we can check your progress is how much your posture is changing. Now, Tara does nutrition, counseling, and fitness coaching, so she's in fabulous shape. If you need a good fitness coach, she's wonderful. But what we're going to look for is when you're looking straight ahead, we want to see if the ear is lined up over the shoulder should be lined up over the hip, and the hip should line up over the ankle. And then from the front, we should see the head's nice and level with the ears, shoulders are nice and level, hips are nice and level. You should be able to run a line down your spine from your head right through your tailbone. Thank you, Tara.